We are back with our sponsor, Dr. Mimi Lee, a board-certified surgeon who specializes in leg veins and also facial aesthetic treatments, and she's here to explain a little bit more about all of those treatments that she offers. Welcome back.
Thank
you haven't been here in a little while.
Thank you.
Good to see you. You've got a lot of treatments. We're going to talk about Botox and how many people are coming in for that now, but first, let's talk about the leg veins and the different ones that you treat.
Right. We see mostly two types of veins. The first one is the ropey, bulging kind of varicose veins. Most people think they're cosmetic, but there's actually circulation problem with these veins. They're usually caused by an abnormal internal vein. So if this circulation problem is left untreated, it can cause leg pain, swelling, skin changes, which will present as discoloration, itching, and even ulceration and blood clot.
So you really need to have these things, right?
The great news about it is, treatment is very simple nowadays. We can carry in office, and we can treat the abnormal internal vein with energy or medical glue.
Oh, wow.
And depending on the severity of the condition, some treatments are covered by insurance, and we're happy to, guide our patients as far as what may be what they need.
Okay, then let's talk about spider veins, how they're different, and I think we've got some video that shows how you treat those.
Yes, so those spider veins, they're like little purple and blue venules in the legs. They're usually harmless, but they could be very annoying, and we have treatment that involves just little micro injections, and it takes a few sessions, and then it just magically gone. So I call that the itsy bitsy spider vein program.
Itsy bitsy spider veins, and we're going to show you kind of how, it literally works like that. Now, Mimi's been coming on the show for years, and I always show her my spider veins. I finally came to your office and had this treatment, and I can tell you it was painless. It really was. That needle is so small.
Yes, and we also use a solution that is different than the old-time saline. It's called Asclera. It's a lot more gentle. And so patients literally just come in and relax, and we get it taken care of.
Yeah, if you've had them done in the past and thought it hurt, or I had to wear, I had to wear full support hose, things have changed and they've gotten easier. So, and I'm in my treatment, so I'll keep everybody updated on that. Let's talk about Botox and fillers that you do now.
So, Botox and fillers have a lot of buzz about it because it is a very quick and simple, very non-invasive treatment that can kind of perks us up a little bit, And so Botox is mostly used to treat wrinkles around the upper face, like the forehead, between the brows, and at the crow's feet. And you can even treat the little fine lipstick lines, that many of us hate, when the lipstick bleeds.
Yeah, so, when it kind of feathers.
So, and the effect lasts about 3 to 4 months, and it only takes 10 minutes or so to do.
Yeah, and you always do these treatments. It's not someone else in the office. Because you're a doctor and you understand how the facial muscles work.
Exactly.
Yeah.
And we also do dermal filler treatment. What it does is that it repairs the volume that we've lost, through, aging. And it can treat the hollowness under the eyes, kind of lift sagging cheeks and little sagging jowls. And, it can make someone from looking sad to just looking more pleasant, and because often we get misread if we look certain way.
Yeah.
And the key, just like you said, for a good treatment result is having someone understanding the facial anatomy and also knowing why someone looks sad, So if you treat the cause of the problem, the result are just, more beautiful and more natural.
Yes.
And so that's what I emphasize on. I think, people think about these treatments as just a very quick and simple, but in fact, there's a lot of thinking and artistry involved.
Right, and I think a lot of people, maybe they want this, but they don't want too much. They don't want to go overboard, and you're going to be sure they get the result that they're looking for.
That's correct, yeah. And I love doing so.
Absolutely, and sometimes people just say, you look tired, or like you said, sad, and you don't want that if you feel good. Let's talk about the consultation process. You've got a free one coming up?
Yes, so we are hosting a couple of days of a free consultation event, so I can talk to patients who may have interest in any of these treatments and just give them some guidance. Anyway, I would love to meet some of your viewers.
Yeah, after having gone to the office, the sweetest staff in the world, just made everybody so comfortable there. And I know they'll do that to you as well. So do they need to call in and set up an appointment for this? Okay. during April 11th and April 19th, so this Wednesday and then next Thursday. So jot that number down and give them a call, and they'll get in the consultation. I mean, you took like 2 seconds
Yes.
to say you have itty bitty spider veins, and we
Yeah.
can take care of them. And